afternoon, everyone. Thank you for this opportunity to meet with you today. My name is Joan Meunier-Sham, and I am the director of the Department of Public Health Sexual Assault Nurse Examiner Program. But today I'm here with you in the role of an ambassador for the COVID vaccine, and to help answer any questions that you may have about the vaccine, to provide some scientific and reliable information for you to use for you and your family members as you're making decisions about your own choices for receiving the vaccination for COVID. So I want to let you know that this PowerPoint is available to anybody who would like to use it for your personal use. It's also available in 10 other languages. So if there are people in your communities who English is not their primary language and would benefit from some of this knowledge in a different language, this PowerPoint is available. At the end of the PowerPoint, you'll see a link to multiple resources that are developed. And the Department of Public Health developed this PowerPoint to be used by the community. So this is for everybody to have information, each of you individually, if you're getting questions from friends or families, that you can answer with accurate information. So I just wanted to let you know that that is available for you and for your use. So we're going to go forward today. And I want to begin by acknowledging that there's been a lot of historical and current racism and other forms of oppression that have caused harm to people of color and persons with disabilities, being used for medical experimentation by the scientific communities. And therefore, there's a lot of well-placed distrust and skepticism about COVID and about the use of vaccines, and some mistrust around the medical community. So it's really important to put this out up front, because it's really important that people understand that the information that we are sharing with you today is accurate. We are trying to honestly share information about what is safe, about the development of the COVID vaccine, and what we know and what we don't know. So that we can provide information that you can have conversations about choices for yourself and your family. This won't address all of the questions that you might have, but we are happy to answer any questions. And you'll see at the end that there are a ton of resources available on the DPH website that allows you to get more information that you might need. But for this presentation is really to provide you with some of the facts and some of the questions that we hear a lot from people about the vaccine. So that's what we're going to spend the next time together reviewing. So what is a vaccine and how does it work? Well, vaccines prevent diseases that can be very dangerous and even deadly. And as we know, COVID-19 is certainly one of those diseases. They work with your body's natural defenses to help you stay healthy by helping you develop protection from the disease. When you have a vaccine, it helps to stimulate your immune system to produce antibodies, which are called B and T lymphocytes, just like you were exposed to the disease. After you have the vaccine, if you later get exposed to the vaccine, to the disease, you then are immune and you're protected from the disease, or usually at least protected from the most serious, deadly consequences of a disease. So this is what makes vaccines very powerful medicine, because unlike most medications which treat or cure diseases, vaccines actually prevent the disease from happening. So what are the benefits of getting the COVID vaccine? Well, the good thing is that there's almost 8,200,000 people in Massachusetts who have been vaccinated fully, who have received one dose of the vaccine, and almost 4 million who have had both, who are completely vaccinated. So it's really exciting for those people to help them stay sick. It also allows us to get our community back to normal, which we are beginning to see as people are being vaccinated. And also knowing that we can protect ourselves. So there is just a lot of positives to getting the vaccine. What is important is that both doses of the vaccine, if you're getting a Pfizer or Moderna vaccine, are important to receive. If you get the J&J vaccine or Johnson & Johnson vaccine, that is only one dose. But the more people that get vaccinated, the faster we can get back to our normal lives. So what vaccines are available? Well, currently there are 3 vaccines that have received emergency use authorization from the Food and Drug Administration. And the 3 vaccines are known as Pfizer, Moderna, and Janssen, which is also known as the J&J or the Johnson & Johnson vaccine. All 3 of these vaccines have been shown to be safe and highly effective against serious illness, hospitalization, and death. Both the Pfizer and the Moderna vaccines require 2 doses that are given 3 to 4 weeks apart. It's very important that people get both vaccinations doses in those vaccines. A study that just came out this week showed that it was very, very effective in preventing over 94% more effective against people who had no vaccine when people have received both doses of the vaccine. And there's some concern that if people have only received 1 dose of the vaccine, that they may have less protection against some of the variants. So again, important that people get both doses of the Pfizer and the Moderna vaccine. The Johnson & Johnson requires only 1 dose to be fully effective. And after both of these, all 3 of these vaccines, it's a 2-week period to be considered fully vaccinated. The other exciting news that is coming out is that these vaccines, again, are being shown to be highly effective against the newer variants of the COVID virus that we're hearing about. So that's really exciting to know that this is protecting people from even the new variants, which can be deadlier and cause worse illness. So how do we know if vaccines are safe? And these, are really important questions for people to ask. It's important for people to be open and honest about what we know and how these were developed, because there's been a lot out there in the media, a lot on social media, that a lot of misinformation that has left people very concerned about, should I take this? Why should I take this? This happened very quickly. This seems very political. So I want to just talk to you about, the safety of the vaccines. So vaccines go through more testing than any other pharmaceutical or drugs. First, a small group of people received the trial vaccine, and these vaccine trials began last summer. As soon as the vaccines were made, there were people volunteering to be part of the trial vaccines. Once they were shown to be safe with a small group, they were then given to specific groups of people that were clustered by age, race, physical health. And then once it was showed that they were safe within those groups, they were then tested on tens of thousands of people. So they were being tested for their effectiveness and their safety. And how do we know that they are safe is that the CDC's Advisory Committee on Immunization Practices then looked at all of this data from the studies that were done on the tens of thousands of people. They then made recommendations to the US Food and Drug Administration. Because we were in a pandemic, and the pandemic obviously had life-threatening consequences, they were giving the emergency authorization to use these 3 vaccines during the pandemic. They are all going through full FDA approval, and it is expected that that will happen for all 3 of these drugs. But there was a specific advisory committee that looked at all of the data and decided that it was safe to use, and the risk highly outweighed of getting the COVID vaccine were very low compared to the risk of getting the vaccine, the COVID disease, excuse me. So really the need to take the vaccine outweighed any risk, and that's why it was released, and we have been using the vaccine now for the past several months. Some people have said, well, what about the Johnson & Johnson vaccine? We heard that there was a question with the Johnson & Johnson vaccine. And I think the thing that's important about the Johnson vaccine and the fact that we stopped it was an important example of how people are monitoring the safety of these vaccines in real time. So on April 13th, the FDA and the CDC paused the use of the J&J vaccine because there were 6 women who developed a rare blood clot soon after getting the vaccine. A group of scientists studied this data about these blood clots. They gathered more data around the world to look to see who got the blood clots and what might have caused them. And then on April 23rd, based on review of all of this data, they decided that it was safe to start using the vaccine again, and that the very large benefits of the vaccine outweighed the very small risks. And what they found was that there were 15 all women who developed this rare blood clot out of 8 million people who had received the Johnson & Johnson vaccine. All of the women were between 18 and 59 years of age. Most of them had other risk factors, including obesity. And so it was determined that, you know, out of 8 million people, 15 women developed these blood clots. And therefore, again, the risk of getting the vaccine were very small compared to the risk of getting COVID. So basically, they moved forward with using the vaccine again. Sorry, I feel like I'm stumbling a little bit here. Also important to know that the FDA and the CDC continue to follow any side effects. They investigate any kind of severe reports of reactions to the vaccines that have been coming. But millions and millions of people have received the vaccines, and most have few, if any, side effects. So the other question that gets asked again, and rightfully so, is how did this happen so fast? It seemed like it happened really fast. What's important to know is the timeline was sped up, but corners were never cut on safety. And this is how we know that. One is that we already had a lot of information about the coronaviruses. So coronaviruses have been around for a long time. They have been being studied by scientists for 20 to 30 years. So it wasn't a new virus that was being studied. They're called coronaviruses. People may have seen the pictures. They have like spikes on them. Corona means crown in Spanish, and the spikes on the top of a crown are the kind of characteristic spikes that you see on the coronavirus. So that's why it's called the coronavirus. And this has been studied for many years. There were a lot of people who volunteered last year to come forward and to volunteer to be in clinical trials because this was such a deadly disease. People stepped up, and it didn't take a long time to recruit volunteers. That sometimes happens when other types of trials are happening. The other thing that happened is the US government, as we know, and a lot of governments across the world invested a lot of money to support the development of these vaccines because of the deadliness of this virus. And at the same time, the countries were working together. So there was a lot of global participation and collaboration in the development of these vaccines. Likewise, manufacturing happened at the same time as the safety studies. So usually the safety studies happen first and then the manufacturing happens after. But because there had been so much work going into these types of vaccines that have been developed, things were ready to roll. And you'll see on this slide that normally what happens down the bottom is that the research happens first. There's some development of the vaccine, it's tested, the approvals happen, then it's manufactured and developed and delivered or administered. So in the COVID timeline, the research and initial development were happening, the testing was happening at the same time as the manufacturing and development. And again, that's because they have been doing these vaccines for several years and had the technology available to them. And then approved, and after they received emergency authorization, they were delivered into our arms, as they say. So some of the questions that come up is, can I get COVID from COVID vaccines? And the answer is no. The vaccines do not include live virus that causes COVID-19. This means that you cannot catch COVID-19 from the vaccine. So it's different than some other vaccines. There is no live virus that is in the COVID-19 vaccine. Do COVID vaccines have any side effects? Those of you who have taken the COVID vaccine or know people that have, you may have heard that most people have some side effect. The most common side effect is some soreness in the area of the injection. I had Pfizer vaccine, and that is what I had, was just a little soreness in that area. Some people do have the day after some headache, feel tired. Some people may have a fever or chills or nausea and vomiting. And that's basically a sign that your body is responding appropriately to the vaccine. It is starting to build antibodies to help you fight COVID disease if you are exposed to it later. For the most part, people are told to take the day off after you get the vaccine if you can. I did not need to, and a lot of people I know have not needed to. Some people have reacted a little bit differently, but most people after a day feel totally fine. And so they're normal signs that the vaccine is working the way it's supposed to work. Who was the Pfizer vaccine tested on? So again, this is a safety test. It was tested on over 43,000 people, 16 years of age and older, in 2 clinical studies conducted in the US, Europe, Turkey, Africa, and South America. And you can see in this graph that 51% of the people who got the vaccine in the studies were male and 49% female, so almost a 50-50. You can look at the study participants compared to the state of Massachusetts, with the green being the study participants and the Massachusetts population being the light green. And you can see that it is pretty proportional to the people in the state of Massachusetts, and also proportional to the geographical and racial breakdown of the state in terms of who received the vaccine in the trial. Likewise, for Moderna trial, it is very representative of the racial ethnic breakdown in Massachusetts. And you can see here in the Moderna vaccine, 53% of men versus 43%, but still almost a 50-50 breakdown of who got the vaccine. And this was in 30,000 people, 18 years of age and older. And in the Johnson & Johnson, it was 43,783 people, 18 years of older, who received the Johnson & Johnson vaccine. Again, more males than females. My colleagues like to joke that that's because it only involved one injection versus 2 for the Johnson & Johnson. The other thing about the Johnson & Johnson is that it does not require freezers and low temperatures like Moderna and Pfizer do. So it is a lot easier to administer the Johnson & Johnson vaccine because it does not need the refrigeration requirements that the other 2 do. But obviously, as you can see, these tens of thousands of people that the 3 vaccines were tested on, again, pretty reflective of the Massachusetts population. This is a little bit so. Less so, but really across racial and ethnic populations, it was pretty much equal to the representation of those populations across the country and in the state. So one of the questions that comes up is, should somebody with allergies get the COVID vaccine? And so that's a good question. The answer is no. If you have a vaccine to any of things in the COVID vaccine, you should not get the vaccine. However, the things that are in the vaccine usually are not things that normally people have allergic reactions to, such as eggs, gelatin, preservatives, or latex. Those things are not in the vaccine. There's a list here you can see. You can go to the fact sheets for each of the vaccines, and it will tell you what is in those vaccines. Usually people are not allergic to anything that is in those vaccines. If you do, however, have a history of severe reaction to something that isn't in the vaccines, like peanut butter or eggs, you should talk to your healthcare provider before receiving the vaccine. It is sometimes recommended that somebody who may have a severe allergic reaction to other things not in the vaccine may be better to have their vaccine in an area where they are carefully monitored. And probably most of you know that when you go to get a vaccine, you are asked to wait for 15 to 30 minutes after the vaccine so people can watch for any kind of side effects, which again, I have heard have been extremely, extremely low. So that happens for everybody, but if you do have severe allergies to anything in particular, like eggs or peanut butter, you should talk to your doctor, and you should probably make a plan to go where you may be observed a little bit longer than the general population after having the vaccine. One of the questions that comes up is, I would like to have a baby, my daughter, my granddaughter would like to have a baby one day, and they're concerned about getting the COVID vaccine. Is it safe to get it? The answer is yes. People who are trying to become pregnant now or want to try in the future should receive the COVID vaccine if it's available to them. Based on what we know, experts believe that it is safe for someone trying to become pregnant in the long term or the short term. And there is absolutely no evidence that it impacts fertility. This is some of the misinformation that is out there. It's some of the misinformation that some of the teenagers are hearing. And it's really important to know and to share that there is no information that is leading to this vaccine causing any fertility issues in the future or in the present time. Can someone who is pregnant or breastfeeding get the COVID vaccine? The answer to this is yes. And this has been more strongly supported recently with more research. The American College of Obstetrics and Gynecologists recommend that the COVID vaccine be offered to pregnant and breastfeeding individuals. They just finished a big study with 35,000 pregnant individuals and followed them throughout their pregnancy and after, and determined that it was extremely safe for people to get the vaccine. And so they are now strongly recommending it, that they have not found any concerns to date. What we do know is that women who are pregnant, or individuals who are pregnant who do get COVID, do have an increased risk of severe illness, and it may also increase the risk of preterm birth. So pregnant women who do get COVID can get quite sick and may have a premature baby. And for that reason, it is recommended that pregnant people or breastfeeding people do get the COVID vaccine. Again, it is a personal choice, as everything is, and it is suggested that people talk to your healthcare professional if you are pregnant and or breastfeeding about getting the vaccine. But the American College of Obstetrics and Gynecology has now recommended that pregnant people receive the vaccine. And in fact, that the antibodies that the mom gets carry over to the newborn. So it's also an added boost for the baby who is breastfeeding. The questions are COVID vaccines safe for children? People may have just recently learned that the Pfizer vaccine has now been authorized for people or children ages 12 and older. So that's just been in the past month. And the Pfizer vaccine is being offered to middle schoolers and high schoolers now. And it is anticipated that the Moderna and the Johnson & Johnson will be at some point. They are going through tests with teenagers at the moment, but right now Moderna and J&J vaccine are authorized for patients 18 and above. But for a Pfizer vaccine, 12 and older are eligible for it. And there are actually, for younger children, there are studies going on right now. So I believe that they're starting as young as 2 years of age. They're doing some studies on the effectiveness of the vaccine in younger children. But for right now, Pfizer for patients or kids 12 and older, and then for 18 and older is from Moderna and Johnson & Johnson. Will COVID-19 change my DNA? And the answer to that is no, because the COVID vaccine does not go into the cells of your body, and it does not where your DNA is, and it does not interact with your DNA in any way. The COVID vaccines, some of them are known as messenger RNA viruses, and what they basically do is a small segment of the DNA from the virus is used, but it is not the virus, the full virus that causes the disease. That is injected as part of the vaccine, and it goes on to the outside of cells, and it stimulates your own cells to create these spike proteins that I talked about before was on the COVID virus. And so your own body starts to develop these spike proteins because of the vaccine. And then the vaccine, basically goes away. Your body now has the antibodies. And so the next time your body is exposed to the virus, you are protected because you now have developed these spike DNA antibodies. So another question that people ask is, how do I make an appointment? You can use vaxfinder.mass.gov to search for appointments at mass vaccination sites. Some of you may have heard that some of the big mass vaccination sites that were happening at Fenway and Gillette are closing, and more focus now that the majority of people have been vaccinated is to trying to get the vaccines more in local settings. I understand that your senior center had a vaccine drive, which is wonderful. My town recently had one for the high schoolers. A lot of local clinics, CVS, Walgreens are now having them, and many practices, private practices and group practices are trying to get vaccines also. So there's a lot of ways to get vaccines now that they are much more readily available than at the beginning when they were first available. There were not many vaccines, and there were a lot of people who were waiting for them. So we're really excited that they're readily available now. So pretty much anybody who is 18 and older can get the Moderna and J&J, and anyone who's 16 and above can get the Pfizer. 12 and above can get the Pfizer vaccine. If people don't know how to use the internet, you can also call the Massachusetts Scheduling Resource Line, which is listed here. What if I need help getting to around a vaccination site? So there is some in-home vaccinations that are happening now. Sometimes your own primary care clinician or visiting nurse may be able to provide that, but this is a line where you can call to get somebody an appointment, or yourself an appointment, to have somebody come to your home to provide the vaccine if you're unable to get outside. The other thing that is great is that people who have Mass Health can get free transportation to a vaccine site if they have Mass Health or use the health safety net. And you can call your health plan directly, or you can call Mass Health directly at this 1-800 number to schedule. All of the vaccine sites must have wheelchair accessibility and do not require stairs. And they are often when you sign up for your vaccine, you'll be given information, usually by text or by phone, but people are really great about telling you how to access the site, where to go in and out. I got my vaccine at Fenway in the Heinz Auditorium, and I was shocked at how quickly I got in and out of there within 30 minutes. It was really great, really well run. And now that it's more on an individual basis, people are making sure that people have access to the vaccine. Will I have to pay for the vaccine? The answer is no. The vaccine is free to all Massachusetts residents. You'll never be asked for a credit card to make an appointment. You can get a vaccine even if you do not have insurance, a driver's license, or a social security number. Other people worry about their immigration status, and it's really important to know that getting a vaccine will not change your immigration status, whether you're able to stay in the US, get a green card, or get public benefits like housing or SNAP will have no impact by getting a vaccine. No matter what your immigration status is, it's important for you and your family to be safe from COVID-19 and to get vaccinated. You can get a vaccine even if you don't have insurance, a driver's license, or a social security number. And as I mentioned to you earlier, this PowerPoint is in 10 different languages available to anybody. If you know people who may not speak English or may not read English, you can go to the DPH website and actually download this PowerPoint in different languages. Also in different languages, multiple posters around mask wearing, around the facts of the vaccine as well. And those resources are all available to you. What happens if you get the vaccine and you experience symptoms? Was I mentioned to you, when you go to get the vaccine, you'll be given a handout which basically tells you what are the signs and symptoms that most people will experience, which is often the sore arm, maybe a headache, maybe some aches or pains or fever. But if you have a lot of discomfort or pain outside of what is expected, it's important to talk to your healthcare provider. The other thing to know is when you get your vaccine, you will also be giving information about the system called VSafe, which is a vaccine site that is web-based that you can put right onto your phone. And if you have any questions or you feel like you're experiencing symptoms beyond what are the normal, you can contact them and they will follow up and track you and give you guidance of what you should do if you're having any signs and symptoms that are concerning. And this is how the information is coming in around complications. That's how they got to find out about the blood clots from the J&J. So this is a safety monitoring process that is in place, and you would be given information about this when you receive your vaccine. You don't need to respond to it, but if you want to, you can, and it's there for your use, and somebody is there 24/7 to answer questions. How long after getting COVID vaccine does it take to be effective, and how long does it last? Well, it takes 2 full weeks for a body to be fully immunized. So basically 2 weeks after you get any of the 3 vaccines before you're fully protected. So before that time, it's important that you continue to wear a mask because you still are not fully protected. It does mean that you could be infected with the virus that causes COVID just before you got the vaccine and get sick. And that's because the vaccine has not yet had enough time to provide protection. And so that's why once you get the vaccine, you should still be wearing your mask. But there have been a few people who got the vaccine and then they were sick a week later. And that's because they got exposed either right before they got the vaccine or right when they got the vaccine, and their body had not yet been able to build up enough antibodies. What we don't know yet is how long the COVID vaccine will provide protection. This seems to be, most people are thinking, or scientists are thinking, that we will probably need a booster shot, just like we do with flu shots. We may need some booster shots to the COVID virus. As I mentioned to you, the good thing is the current vaccines are showing that they're very effective against the variants. So that's a very good thing because that means it's being effective. But if there are multiple changes in years to come to the COVID virus, there may be other vaccine booster shots that are needed. But there's still a lot of studies that are happening every day and will continue to happen for years. The important thing to know is that COVID is not something that's just going to go away. I think what people and the scientists feel is that we're going to be able to get a handle on it, and the more people that get vaccinated, the better and safer we are. But there are going to be pockets of COVID out there until more people get vaccinated, and it will probably be in our world for years to come. And so getting the vaccine and being safe is the best thing that we can do. And we may in fact need to get a booster shot a year or 2 down the line if we are showing that we are losing some immunity that we received through the vaccine. Do I need to keep wearing a mask if I'm fully vaccinated? So again, that means 2 weeks after you've received your second dose of Moderna or Pfizer, you're considered fully vaccinated, or 2 weeks after you've received your one and only dose of Johnson & Johnson vaccine, you're considered totally vaccinated. If you're fully vaccinated, then only in certain circumstances do you need to wear a mask. And all of you know probably that this is just recently changed, and it's very exciting news, and it speaks to how well we did as a state in getting vaccinated, that we are able to not wear masks if we're fully vaccinated. So if we're fully vaccinated, there are certain circumstances in which we should be wearing masks still, and that's public transportation, healthcare facilities. So if you're going to the doctor's office, the dentist, or the hospital, you will still be expected to wear masks. Schools and other settings with vulnerable populations, because remember, young children still are at risk for the coronavirus. They often get less ill, but there are some situations where kids have gotten very ill, and there have been some children who have died. So they are more at risk, and that's why it's still recommended that we are wearing masks in schools. And obviously congregate care, so nursing homes, people living together, homeless shelters, still recommending that people wearing masks in those environments. The other things that are important to remember is stay home and get tested if you feel sick. So if you're fully vaccinated, you could still potentially get COVID, as I mentioned, because you may have gotten exposed right before you got the vaccine, or the vaccines are highly effective, about 90 to 95% effective, but there's still a small chance that you could still get sick. So if you are having symptoms of COVID, it is important that you isolate and get tested as soon as you're able to do that. So who can help me make decisions about getting the vaccine? Anyone that you can trust in a healthcare provider, your doctor, your nurse practitioner, your healthcare insurer, your pharmacist, or a community health worker can help you make decisions about getting the vaccine and getting information that is accurate. Again, there is so much misinformation that is out there, especially through social media, that it makes people anxious and nervous, and plants a lot of seeds of doubt for people. But it's important that you get the best information possible, which I hope I am sharing with you today, which is readily available to you by going to the DPH website, and you will now have this information on this YouTube recording. So where do I learn more? Who has gotten the vaccine so far? You can see every day this is updated. There's general questions about the vaccine and about COVID. As I mentioned to you, these are multiple languages, and it's really exciting to have these materials available in so many languages. So there's all of these websites that you can go to get accurate, scientifically based, sound information. And if any of you would like to use these forums, there's additional materials that can be used by going to these to this website, and it will answer questions about should somebody who has had COVID be vaccinated. So a little bit more in the weeds, if you will, details that are more specific about somebody, questions that somebody may have. It is important just so people to know that if people have had COVID disease and were infected with COVID disease, it is still highly recommended that people get the COVID vaccine once you become without symptoms or asymptomatic. So for people who have had COVID disease, once they do no longer have symptoms, it is recommended that they get the COVID vaccine. And these are more tools and resources, again, in multiple languages. There's videos, some of them are more like little cartoons. There's also materials that are geared to teenagers. So they've really worked really hard to get these materials available. And so I want you all to know that they're available for you, for yourself, and for you to share with friends and families. What we know is that there are some people who are hesitant to get vaccines because of a lot of misinformation that is out there. And often knowing that somebody that they love and care about has gotten the vaccine is often a big help to other people. So you can feel free to use these materials however you would like and however they are helpful to you.